to today's Pet Pawcast. I'm your host, Dr. Roberta Westbrook, and thank you for joining us here at the Houston SPCA, the campus for all animals. Today, we have a really interesting and hopefully very helpful topic for you today. We're going to be talking about pain recognition and pain treatment in your pets. You know, this is a really interesting topic because sometimes it can be difficult for owners to recognize pain in their own pets and to understand how to treat it. And there's some things that are similar to humans and some things that are very different. So I'll hopefully give you some very helpful information. So think about your questions and be ready to post them in our chat. And while you think about those things, also, I want to introduce you to a wonderful pet that we have available for adoption. Our pet of the week is Chino. Chino is about a 10-month-old neutered male. He's a wonderful, wonderful dog with lots of energy. Since he's young and still a puppy, he's got lots of energy. If you are an active person, you like to go on hikes or runs, or you have children, or maybe even another dog that's very active, Chino might be a wonderful addition to your family. He's really playful, loves toys, knows lots of commands, how to sit, how to lie down and shake. He's a really, really great boy. So please come on down and take a look at him. You know, Chino was abandoned at our shelter just when he was a few months old. So he had some wounds that have been treated, and now he is in perfect health. So please come on down and visit with him. And his coat is beautiful. You can't appreciate it on camera maybe, but he's very, very soft, got a beautiful coat. So come on down and visit him and take a look at all of our other dogs and cats and puppies and kittens and rabbits and guinea pigs and everything that we have available to make part of your family. There's no appointment necessary, so you're welcome to come in our adoption center and look around. So we'll see you this weekend, hopefully, this holiday weekend. Okay, so let's get started on talking about pain in pets. So September is Pain Awareness Month. And so hopefully you can take some things away from this discussion and maybe it will be helpful. So let's talk about some things in pain with animals. You know, growing up and for many, many years, people did not associate pain in animals the same way that they do in people. Oftentimes people thought, oh, you know, animals don't feel pain the same way that people do. And animals are tougher. They're able to endure more. And in some ways that can be true. But what is really happening is animals have developed sort of defense mechanisms and ways to hide their pain that actually help them out in the wild. For example, a vulnerable animal out in the wild is more likely to become prey for other predators. And so animals over time through evolution have learned how to hide their pain and how to continue to eat and drink and move and go on about their daily lives despite being in pain. So we shouldn't think that animals don't feel pain, but they do show it in slightly different ways. And that's their way of masking it out in the wild to protect themselves. So please know that anything that you think would be painful for a person is actually painful for animals. And that's because the pain pathway, the way that we experience pain, is actually the same in people as it is in animals. When we experience pain, which is an emotional or a physical sensation, and it could either be an actual painful feeling or a perceived feeling. When we feel pain, it actually transmits to our brains the same way that it does in animals. So anything you feel like is painful could be painful in our pets. Any questions?
Yeah, so I guess, one of the main myths is that the pet isn't in pain because he's not crying out.
Oh, that's a great question. So that goes back to how do we recognize pain in animals? Because like I was saying, they are good at hiding it. And so we have to look for more subtle changes in their behavior. We will cry out. Sometimes you'll have your dog or your kitten cry out in times of pain, but oftentimes the signs are subtle. So signs of pain could be lethargy, just being more quiet than normal, not wanting to move around. It could be paying more attention to a particular limb or area of the body. So favoring a paw, licking a paw, limping. Sometimes it's obvious and they're limping. If the animal has oral pain, sometimes oral pain from the mouth can be shown through salivation because they don't want to swallow. So that could be oral pain from ulcers. It could be not wanting to eat. It could be weight loss. So there are lots of things that animals do to show pain that can be very, very subtle. So you know your pet best. You know their routine. You know how they normally behave. When you notice that something is off, maybe your pet doesn't want to jump on the bed or doesn't get down off the couch quite as easily or is limping or not eating, those might be signs that there could be pain going on, and it's time to see your family veterinarian.
So you mentioned, common, everyday signs. Are they behavioral signs as well? Like, could they become more aggressive?
Sure. So aggression is one too. So some of the behavior signs are just like that. Not eating. Avoiding people, hiding, maybe not grooming, or sometimes licking a particular area. But yes, aggression is one of those behavioral signs where if a animal is painful and they anticipate you coming toward them to touch a painful area, they may resist that by growling or attempting to bite. And it's really, they're trying to tell you, hey, don't touch that area, or when you touch that area, it hurts. So yes, aggression in the moment could be a sign. And again, it's not that the animal is mean, the animal's just painful.
And what are the different types of pain versus like acute versus chronic?
Yes, there certainly are different types of pain. So when we think of acute pain is pain that occurs in a short period of time and very suddenly. So usually this is pain that comes on very quickly, goes away very quickly, and is easily identifiable in terms of its location. So acute pain would be, for example, we stub our toe, or maybe your dog is running and twists his knee, and so he has acute pain, he starts limping. It's something that has a sudden onset, but typically has a short duration and is easily treatable, and we can localize that pain quite easily. We can localize it to the foot, to the ear. Now, chronic pain tends to be, again, over a longer period of time. Chronic pain tends to be more difficult to manage, and sometimes chronic pain, depending on where it is, can be more difficult to localize. For example, if an animal has pain in the belly, sometimes it's hard for us to localize that, because it's not like we can say, hey, my liver hurts or my kidney hurts, right? So sometimes animals that have sort of chronic pain in the abdomen, we may not be able to recognize that. But chronic pain, again, longer period of time, sometimes more difficult to treat because it's a chronic condition.
So then that's a good, question. How does a vet determine the cause of pain, especially if it's chronic?
Yes, if you're bringing your pet in, sometimes you may think that your pet is painful, or sometimes you're just bringing your pet in because you feel like they just aren't doing right. They just aren't doing what they normally do. Well, this is where history comes in. So when your veterinarian is asking you a history, what has happened in the last few days, few weeks, maybe even a few hours, this is when we need all the information that you can give us. Tell us about, when you noticed the signs coming on. Is your pet vocalizing? Are they limping? This is when you can give us all the information. So history is very, very important. The next part that's very important that's going to supplement your history is our physical examination. So we are going to do a tip of the nose to the tip of the tail examination. We're going to feel all the parts of the body and see if we can determine what area of the body your pet is painful on. Are they tense in the abdomen? Do they kind of whimper when we touch an area? Do they have decreased range of motion? So that might mean, okay, if I'm examining your pet's paw, normally when I examine your pet's paw, I should be able to bend the paw all the way back. But if your pet has an injury to this area, I might not be able to do that. It might be a little stiff, or your pet might be, unpleasant with that. So our physical exam is very important. And then the third part of diagnosing where the pain is coming from is doing tests. So sometimes we have to do tests like x-rays to determine where we think the pain might be coming from. So history, physical exam, and then testing is going to give us all the information that we need.
And what are some underlying health issues that can cause pain?
Yes, there's lots of underlying health issues that can lead to pain. So typically we think of pain as trauma, an injury to the limb, or a cut, a laceration or something. But certainly there can be health issues like glaucoma, for example, an increase in the pressure in the eye. That's an underlying condition that can actually cause very painful eyes. Or, it's very common for older animals to have arthritis. And so that's not traumatic. It's something that happens over time, with age and as the joints sort of degenerate, they can get arthritis, and that can cause pain. Sometimes animals can get gastrointestinal disorders, inflammatory bowel disease, or sometimes intestinal parasites or viruses that actually cause abdominal pain, like vomiting and diarrhea. So there's lots of underlying conditions, again, which is why we need to do so much testing to help us figure that out.
You mentioned arthritis. Is that only seen in older dogs?
Great question. Arthritis is not only seen in older dogs, so you can get arthritis in young animals, particularly if they're born with abnormal conformation to the joints. So when animals are born just like us, we want the joints to form appropriately so that they can bear weight appropriately, exercise appropriately. But sometimes the joints are not formed correctly, and that can lead to early onset of arthritis. And that's because the way in which they bear weight on those joints is abnormal. And so over time, the joints get irritated, and they can have arthritic symptoms sooner rather than later.
And so as their pet becomes older, one of them is saying it's harder for them to move around. What can they do to help at home with arthritis?
Yes, if you have an older pet or even a younger pet with arthritis, one thing that's very important is to keep their weight under control. So weight management, because you don't want a pet that has a heavy or being overweight, because it's going to put additional pressure on the joints and could contribute to their sedentary lifestyle. And the sedentary lifestyle also makes the joints less movable and less limber, so they're less likely to want to be active. So also giving them low stress exercises. So just walking, leash walking for 5, 10, maybe 15 minutes twice a day, getting those joints moving, that can actually help with pain. You don't want to overdo it, but certainly keeping the joints moving can actually help to decrease pain. And then you can talk to your family veterinarian about supplements. So there are some natural supplements that we call nutraceuticals, and these natural supplements can be added to your pet's food to kind of help keep the joints very healthy. Those are things like chondroitin and glucosamine that keep the joints very healthy.
So talking about medications, Nora asked, are there any safe over-the-counter medications we can give our pets, especially when we're waiting to get that appointment, especially if it's a holiday weekend?
Right. If you're looking for something over the counter for your pets, I would honestly avoid all over-the-counter pain medications, because what you're more likely to reach for are things like aspirin or acetaminophen or ibuprofen. These drugs can be toxic to dogs and cats. The dose of these drugs is really should not be given to dogs or cats at all, but in some cases where they are prescribed, the doses are very different than they are in people. So you can't just give your pet, a full aspirin, or ibuprofen or acetaminophen. These things can be toxic and can cause liver and kidney failure. So please contact your family veterinarian about medication, and don't try to do these things at home. It's best just to let your pet rest than trying to medicate themselves. You medicate them yourselves, you might do more harm than good.
So if if a Chihuahua sprains his leg, from jumping too high, what can they do at home to help relieve that pain? Or, is it something that they can do at that moment until they get right into the vet?
I would say, keep them quiet, just let them rest. And then just contact your family veterinarian. If it means going to an emergency hospital, sometimes it means just going to an emergency hospital, but you don't want to do anything at home that could make it worse. Sometimes even you manipulating the limb at home can make the animal be more painful. So I would advise not trying to do too much manipulation of the limb at home, not trying to figure it out on your own, because you could be hurting the animal more. And you certainly don't want to give any medications without talking to a veterinarian first.
So the medication that we have, in our cabinet can be dangerous to them. So do they have a different type of pain medications for them, or what are the different types that they can be given?
Yeah, so the interesting thing is the pain medications that we take are called non-steroidal anti-inflammatory drugs. And yes, there are non-steroidal anti-inflammatory drugs that are labeled for use and manufactured for use in dogs and cats. And so we have some examples of those here, of some of the drugs that your veterinarian might prescribe that are approved for use in dogs and cats. And so there are similar drugs to what people use, but these are formulated specifically for dogs and cats because the way that they metabolize the drugs is very different than the way we do. And so which is why you can't use human medications. And then because sometimes their liver and kidneys are just not able to handle it, so it's better to use something formulated specifically for them. And these drugs can come in liquid form or tablet form. And so there's a variety of ways that you can use these safely for your pets at home.
Yes, and our dogs love pill pockets to help giving those pets.
Exactly. You could put them in a little treat and they'll love it.
And are there any side effects, especially long term, for these NSAIDs?
Sure. So these non-steroidal anti-inflammatory drugs, when given over a period of time, although I will say, let me say that most of the ones that we have for use today are really safe, and they actually do have very minimal side effects. But it is certainly possible that with long-term use, they can affect the liver or the kidneys or the gastrointestinal tract. They can affect a very healthy molecule in the body called prostaglandins. Prostaglandins are very healthy molecules, and sometimes non-steroidal anti-inflammatory drugs will block the production of prostaglandins. But again, the ones that we have are very healthy and typically have very minimal side effects.
So in addition to, surgery or treatments as recommended by a vet, are there any pain like alternatives? So like acupuncture or hydrotherapy that can help?
Yes. So whenever we find an animal that has a painful condition, especially if that condition is chronic, we like to try to use what we call multimodal pain management. So that's using lots of things at our disposal to keep that animal from being in pain. So things that we can do are not only drugs, but if you're a little bit nervous about the drugs or your veterinarian finds that maybe they aren't appropriate for your pet, certainly a lot of what can relieve pain is just TLC, right? Just a little tender loving care, just giving your pet comfortable places to lie down at home, doing some low stress exercises, stretching. There's acupuncture that, veterinarians can be certified in veterinary acupuncture. That may help. Swimming can be a low impact exercise that might work for dogs that enjoy the water and have arthritis. So absolutely, there are other alternatives than straight medications that you can use.
So for a first aid kit, we usually have an ice pack or a heat pack. What can be the use, or when would we use those items?
Yes. So typically when we have a strain or sprain, our doctor might say, put an ice pack on it. And certainly ice can help to reduce some swelling. So I would talk to your family veterinarian. Yes, we have an ice pack here. So this is an example. You can also make an ice pack at home by getting a Ziploc bag and putting some cubed ice in there, and then wrapping that ice bag, if you have one like this, or the one that you make, in a towel, because sometimes putting the ice directly on your pet skin can be a little bit shocking because of the temperature. But yes, on a swollen or inflamed or painful joint, certainly ice can help that. In some cases, your veterinarian may have you alternate ice and heat packs because heat can also kind of soothe the muscles as well, relax them a little bit. And so it depends on the type of injury, whether cold therapy would be better or whether warm, hot therapy would be better.
So a myth that is usually heard is, my pet's teeth can be, isn't painful because they're still eating hard food. Is that correct?
When we're talking about oral pain. So some people may think, well, as long as my pet's eating, they're not painful. They don't have
correct. So
again, it's subtle changes. So you might notice that your pet is eating, but if you're paying close attention, sometimes they're only chewing on one side of the mouth. Or sometimes they're not chewing very much at all. They're almost just scooping the food in and swallowing it, and they're resisting chewing. So if you pay attention, sometimes when pets have painful teeth because they're infected or loose, they will avoid chewing on that side, or they may chew very minimally. So you can pay attention to that, but then at least once a year, have your pet have an oral examination by your veterinarian and some dental radiographs. That will help us determine if there's disease even that you can't see. So disease underneath the gum line, and get those teeth taken care of.
So I was asking, they have a senior dog. Is it safe for them to undergo anesthesia, whether it's for a dental or for emergency surgery?
Right. So, we're talking about pain, and sometimes, older animals, if they have an injury that requires anesthesia to either examine or do diagnostic testing on, people can be nervous about anesthesia in their older pet. Please just trust your veterinarian, because what we will do is not only do a full physical exam, but typically with older animals, with geriatric animals, we will do additional tests to make sure that they are healthy enough for anesthesia. And that typically means blood work and making sure that the liver and kidneys are healthy enough to take on anesthesia. It's certainly not a 100% guarantee. Anesthesia always has inherent risks, but we always do everything that we can to find any risks right up front and make a determination about whether or not your pet should have anesthetic drugs.
And once a pet does have a successful surgery, any tips for, recovering the first few days right after surgery?
Yeah, so sometimes the surgeries can cause acute pain. So even a surgery like a spay or a neuter, it's very straightforward surgery, very routine surgery. But because we are doing some cutting and some tissue handling, it can certainly cause some pain in the immediate post-op period. Follow your veterinarian's instructions would typically include resting your pet for about 3 to 5 days after surgery, not letting them run around because that will usually cause more soreness in the area, not touching the area too much, so protecting it, and then giving some medication. So typically your veterinarian will send you with some medications for those things.
So I think that's all the questions we have about pain, but someone's asking, is Chino good with other dogs?
Yeah, so Chino is good with other dogs. Chino has a lot of, activity and energy. And so when he approaches other dogs, sometimes not every dog wants to be, wants to play and wants to have a buddy. Chino is very good at recognizing which dogs want to be his friends and which ones don't. And he's okay with that. He's okay being friends with the ones who love him and okay playing on his own with the ones who don't. So Chino absolutely gets along with other dogs. So we have had a wonderful show today. We enjoyed Chino, but we want Chino to find his permanent happy home. So please come on down and visit with him. If you are, thinking about your pet and whether or not your pet is in pain, don't hesitate to call your veterinarian and look for some subtle signs and have your veterinarian do an exam and see if we can determine what we can do to help your pet live a happier, healthier, pain-free life. So thank you for joining us again at the Pet Pawcast. Again, I'm your host, Dr. Roberta Westbrook. Come on down to the campus for all animals, and we will see you soon.